Good afternoon, and I want to thank the Louisiana Department of Health and Adaptation Health for inviting us here to present today. I'm Sarah Ratner, and I'm here with my colleague, Ryan Schonecker. So at Revel, we understand Medicaid beneficiaries because we bring a qualitative and quantitative approach together for personalization at scale. And we do this by removing some of the barriers that makes communication complicated and also provide a frictionless experience. Our clients are government program health plans and providers. We focus on this area because these populations are very difficult and health action is critical to managing and improving health, providing a seamless experience, and controlling spend. You put forth a challenge statement that we intimately understand and can help address the problems that you face. We appreciate the importance in helping to eliminate the anxiety and the concern around the Medicaid enrollment and the population in general. And recognizing the diversity and need, our platform is tailored to understand the channel in which beneficiaries want to and can receive information. We've worked with incredibly diverse populations and understand cultural and demographic differences that inform not only the modality, but also how someone is communicated with. Revel has focused on individuals that have been marginalized and are underserved, especially during COVID, since these preferences are becoming much more dynamic based on changing and challenging social circumstances that this pandemic has brought forth for all of us. However, I want to acknowledge and respect the potential for abrasion, and that's very important to Revel. We know flooding beneficiaries with massive amounts of communication can absolutely create chaos and have the reverse effect on enabling engagement in health action. And from all of our work in this space, we truly understand the experiential component is paramount to getting an individual to take action. And these facets require a very diverse communication approach. So for all of those reasons, the areas listed are where Revel has the most success and has been the most successful and can address the challenges that the state faces.
Thanks, Sarah. As you look at the different types of programs that we run to try to engage members, we'll talk about the process in a little bit here, but as Sarah mentioned, those little icons that you threw out as a part of the challenge, you'll see on the top of each of these screens to kind of tie back to some of the challenges that your beneficiaries are facing. But in general, Revel is really focused on being a health action company that's driving people, not just the effort of trying to do something in health engagement, but actually getting them to take that end health actions you're looking for, as well as collecting information through surveys. So I think you've heard a lot of folks today, a lot of great presentations, talk about different parts of health engagement and trying to get people to do things. For us, as I mentioned, we don't believe that health engagement is enough. It's health action that you're looking for your beneficiaries. A lot of times when we start working with our customers, whether it's a state or whether it's a plan or whether it's a provider, they know a lot of information about their members clinically. So they'll know things like you have this diagnosis or here's a gap in care that you're not doing. But they really don't know them personally, and that's really where Revel comes in to try to help. You know, we really feel that people are more than just an line in an eligibility file, and trying to get a really complete picture of who someone is what makes all the difference in trying to get them engaged. There's in our opinion, three equally important aspects of trying to engage somebody, whether you're asking them to go to the doctor, complete a survey, do a redetermination, whatever it may be. And those are know me, meet me, and move me. The know me section is really taking the information that we get from the state or from one of the MCOs and looking at that and saying, all right, great, which is a good starting point. Let's add information to that. So I'll go a little deeper on that. So really create a clearer picture on who we're trying to engage. So in this case, it's Maria that we're trying to get her to take a specific health action. The Meet Me section in the middle gives us a better idea of which channels we'd want to use to try to engage her. The little icons on the bottom there are IVR, email, mail, live agent, and text. When we're engaging somebody, we're always going to use more than one channel, but less than 5 channels to try to engage them. And the reason we do that is to build trust with the member. If you think about just receiving a whole bunch of phone calls or a whole bunch of text messages from somebody you don't know, even if it says this is from the health plan, people are pretty skeptical. So understanding in the Know Me section, what are those preferred channels for that individual, and then reaching out to them on those trusted channels allows you to have a much higher engagement rate. And then it comes to Move Me. So great, you've got their attention via text, email, mail, live agent, whatever it may be. What are you going to say to them that's actually going to compel them to take that health action? And a big part of what Revel does is we go out in the field. We have behavioral scientists and anthropologists that go and sit in the homes of Medicaid and Medicare Advantage members to understand from them what is a health, what's driving health behavior for you? How do you think about health? What are your health beliefs? What are your health biases? How can we speak to you more effectively in order to help really compel you to take a specific health action? And all of that translates back into the content that we write for you in order to get people to take specific health actions. Going back to the first part of this, the know me part, it's really about going back to the basics. This is an example of a national health plan that came to us and said, hey, Revel, they specifically asked us to try to find email addresses on people. And they said, we've tried every way possible to get email addresses on our membership. Here's an eligibility file, see what you can do. So we took their file. What we did is we ended up finding that 0.5% of the people were actually deceased. We found email addresses on 59% of members, which is up from 0. We did find that 11% of their addresses were wrong, and we added secondary phone numbers or primary phone numbers on 78% of members. It meant that when they sent us the file originally, there were only 80% of those people in the file that they could even be reached on any channel. We were able to get that up to 95%. So what does that really mean when we provide and bring in our Revel data enrichment to understand more about a person? And what does it really matter when you're running a program? So I'll give you an example of Maria. So Maria lives in a rural area within Louisiana. So what that means for us, that first part, means that people in rural areas tend to respond to a combination of text and mail. The combination of those two are the highest response areas. The next is she speaks Spanish, so obviously we're going to lead with Spanish. The third is that she plays croquet, which I love as well, but that's meant to indicate that she lives in a retirement community. And what we know is that people who live in retirement communities tend to speak about healthcare a lot more frequently than people who don't, which means that you reach an abrasion point much faster. So you have to use shorter sequences for people who live in retirement communities. And then the last one means that she's still working part-time. And what that does is it influences the time of day or day of week that we would do outreach to her. So Revel Connect platform will make those determinations. And Sarah, you want to talk about a little bit more about how we really look closely at populations and geographies?
So Revel also uses a non-healthcare information to inform our strategy and omnichannel approach, really appreciating the demographic and social circumstances are high influencers of health behavior, just like Ryan discussed. Here, we use the American Community Survey response rates for several census tracts to explore the diversity in approach. So on the first map to your left, we looked at an urban and rural census area. And you'll note the stark difference between the urban and rural, with rural having a lower response rate at 41%, lower income, no health insurance coverage or low health insurance coverage, and the low rate of the FCC's minimum broadband speed. And so I wanna highlight that, because when we talk about internet, we have to look at broadband speed as well, because if they're doing things like telehealth, we know that you can't just use regular internet or have a slow connection, because it won't work. So we layer that on and come up with a profile for a particular area. So turning to the map at the right, there are two census areas that are actually very close to one another. And similar to the urban and rural comparison, you'll notice the huge difference in income between the areas that are very close together, as well as response rate, health insurance coverage, and internet access. So this is just one dimension among many we use for the personalized communication. Another area that's not listed is native language spoken and culture within a block area, because we know these are so important.
Thanks, Sarah. So as we're bringing that information in to give us a better idea of the health inequality that may exist even on the block-to-block level, as Sarah just showed, again, it goes back to having us have a more informed approach on how to outreach to people. So in this case for Maria, as I mentioned, based on the factors that we had, our platform made the decision to create a sequence for her that included text message, IVR, and mail. Our outreach, just so you're aware, we get about 10 million health actions completed every single month, which means that we have a lot of data that flows back in to help us determine, have we seen Maria before? Have we seen someone very similar to Maria before? And that helps us really get a first best approach to try to outreach to her. So an initial sequence is created, which would be IVR, text, text, mail, and text. And what we ended up doing with our platform is that it optimizes itself while it runs. So as we start the outreach for members, what ends up happening is it looks for cohorts very similar to Maria's that may be overperforming or underperforming. And in her case, moving mail up to the third outreach was a higher performance rate. So the platform adjusted, which really prevents you from having to run programs, look back and say, oh, I wish we would have done this differently. It does that mid-flight. So great, now we get to Maria, what are we gonna say to her? I mentioned earlier we do research in the homes of members, and that's really what this is about. So we go and we ask them to sit down with us and say, bring 5 objects that represent healthcare to you, in order for us to try to figure out what are the best ways to engage these populations. Our research team goes out to our highest performing populations to figure out why are we doing so well, and it goes to our lowest performing communities to figure out why are we doing so poorly and how can we continue to improve that. And that's just a cycle of improvement that we do. Our goal, there's a lot of talk about member abrasion. Our goal really is to, it's kind of like the big audacious goal for Revel, is to try to engage people in 2 touches or less. And so our entire focus as a business is driving the right type of outreach using the right channels in order to engage people to take a health action in 2 touches or less. Everything we do is white labeled, as you can see. We don't think introducing our name anywhere in the mix is going to help. It's just going to add more confusion for the members. Obviously, we'll provide reporting back, and I think a lot of the stuff that we find in our experiences now we can capture for you, whether it's bringing in new contact information, giving additional contextual information, giving information back on which channel did they respond on, which time of day, which sequence, all of that information we get back to our clients, because we think it's important that, as you're engaging your beneficiaries outside of your relationship with Revel, you should have that information. It's not just about creating a great experience while you're working with us, it's about creating a great experience for your beneficiaries overall. So we provide that back to you. Obviously, being a results-based organization, happy to touch more on this. Sarah, you want to talk a little bit about this last slide here?
Yeah, so just to wrap up due to time, we're incredibly excited about the potential to help the state of Louisiana. Our approach is intimately aligned with the problems, the dynamics, and the challenges that the state faces, and we've seen it and we've done it before. We combine copious and diverse data sources to create a personalized omni-channel approach and framework, and layered with human-centered design and methodology that Ryan touched on. Through that, we can catalyze health action at high rates and support the need to drive effective communications around eligibility and enrollment for the underserved population. So thank you for having us today, and we can open it up for questions.